Okay. Thanks, Loxley. Yeah, so it is, and I suppose that's the scientific fact that they said some of these vaccines are developed in cells that whose ancestor is from an aborted fetus. That's kind of the scientific fact. And for some people that still might be an ethical issue, but some people have used this and kind of twisted it and said there's actually fetal tissue in vaccines and stuff, which isn't in fact true. So it's just important that you guys all have the facts on that, and you can decide for yourself. So as we have this slide up, there was quite a few different questions about comparing the vaccines. So let me just quickly specifically address those when I've said something. So about the AstraZeneca vaccine, someone asks, is there COVID-19 in the vaccine? If there was COVID-19 in my system, would I get a more severe reaction? So that's a good question, and the answer is no. So again, as I said, COVID-19 is the name of the disease, and the virus is SARS-CoV-2. But the AstraZeneca vaccine, all it has is a piece of DNA that codes for the spike protein. So it said it is a virus, but it's a virus that's known to be safe in humans, and it has a piece of the spike protein encoding. So it doesn't have COVID-19 in it. So that was that one. Another question, in the AstraZeneca vaccine, there's a vector from a modified chimpanzee adenovirus. What is this and how is it different from the RNA vaccine? Yeah, so again, as I mentioned, for the viral vectors, which are from Oxford AstraZeneca and from Johnson & Johnson, different companies will use different adenoviruses based on the vaccine technology they've used in the past. And so Oxford, it's the Jenner Institute in Oxford which has developed these, and they have been working actually in the third world developing malaria vaccines and different ones for many years. So they would have already found that this chimpanzee adenovirus vaccine works well, whereas Johnson & Johnson have a slightly different one. It's not a chimpanzee adenovirus, but it is an adenovirus as well. So they are different. And someone mentions as well, asks about the Johnson & Johnson one. They've heard that we only need one shot and it's 83% effective against the South African variant. That is true. We'll come to that a little bit later, but really, I mean, Johnson & Johnson is really good actually. And can you explain this more? Is it safe? Will it come on the market in Ireland? Well, it will come on the market in Ireland because it's just about to be deemed that it is safe. So the FDA are looking at it at the moment, and the data shows that, similar to the other vaccines that have been approved, that the safety data is good enough to grant emergency authorization for it. So that one is different from the AstraZeneca one because you only have to take one shot of it. So that's just the way they set up the trial. Johnson & Johnson would have decided we're going to see if one shot of this vaccine, how it operates, whereas AstraZeneca, Oxford would have decided, okay, we're going to see what two shots look like. We'll come back in a little bit later to how effective and how potent the different vaccines are. Are there any more questions on... Yeah, okay, so someone else asks about the Pfizer vaccine needing 2 doses, but it's more effective than the 1-dose AstraZeneca vaccine. But don't forget, AstraZeneca is actually a 2-dose vaccine, but it's just that the UK government decided to stretch out those doses much further and to make it go for further. So someone's asking, is it more tolerable, and is it actually... is the Pfizer one cheaper? But the Pfizer one's actually more expensive. It's quite expensive to make these RNA vaccines. And they're very unstable as well, as we know. Did you want to get in there, Loxley?
Well, I just wanted to say that we'd probably come back to the actual effect of the vaccines and what comparisons, if any, we can really make between them.
Yeah.
I just wanted, though, Andy, to what would you say about the question of whether there's a tracking chip in these vaccines?
Yeah, so that's the next question. Let me just stop sharing my screen for a minute. I know it's just so I can keep an eye on the questions as well. Yeah. So the next question is, which we're getting now into vaccine safety and related concerns. Do the vaccines contain a tracking chip? Okay, so this is a good question because it's something that came up in lots of the different videos that people would have seen on social media. And so it's I think this is a good example, in fact, of this idea been a bit like a virus, because it's sort of taken a few different things and put them together, and it's mutated the idea, and it's now spreading in different ways. And the different things the simple answer is no, the vaccines do not contain a tracking chip. The reason that people think maybe that they do was from hearing a couple of different things and then putting together these things. So for example, people hear about Bill Gates, who is a massive proponent of vaccines and has put lots of his money into vaccine development. They also have heard of or seen videos where, in a separate context, Bill Gates has discussed the use of microchips as a sensible way to keep your own patient data, in yourself, so that the doctor could just scan a chip and have all your medical records. And they've also heard maybe that it's possible to put dyes in vaccines so you can know if you're vaccinated or not. And there's also various views of vaccines. And all of these things then are put together, particularly in the context of conspiracy theories. And suddenly now, people have been proposing or purporting that Bill Gates wants to track us all with microchips, and he's going to use vaccines to do that. But this is about 4 or 5 different ideas coming together, then mutating like the virus mutates and spreading through social media, just like the virus spreads to our body. So none of the vaccines have tracking chips. I mean, if anyone wants to track you, all they need to do is know you have a mobile phone. It's a lot easier to track people than putting microchips in them. So there's no microchips in vaccines. I've seen really professionally produced videos that if you did not know about these things, you would be convinced that the reason that people are vaccinating is to implant microchips in people. But it's really, really completely untrue and very misleading. So over to Loxley now, who's going to take the next few questions.
Right. Just before I go on, I just want to clarify something that Andy said, that he would, he would personally be in favor ethically in taking the vaccine, given the circumstances he has outlined. What he's not saying is that he was in favor of the original origin of the cells, and neither of us would claim to have been in favor of that. Andy, I don't know if you want to confirm.
Thank you, Loxley, and that's a good point to clarify. Yeah, thanks.
Okay. So just about the question of, some persons ask, there are a series of questions, one after the other, about, persons getting ill just after being given the vaccine. Is there a link with COVID-19 here? What are the reports of persons becoming unwell after the vaccine? Are there serious side effects? Are there severe reactions? I just want to make one general point here as an epidemiologist, that the basis on which these things are used are their effects in groups, which we call populations. And there is no drug that has ever been approved or disproved or not approved on the basis of its effect on any one individual. So no epidemiologic event or association or effect can either be disproved by an appeal to personal experience. We all know that smoking causes lung cancer, but we all know persons who have never heard of persons who have never smoked a day in their life, and they have been diagnosed with lung cancer. And we all know of individuals who have smoked for 20 or 30 years and have not contracted lung cancer. So with that in mind, I want to address the issue of the illnesses. The reason, is there something there? The truth of the matter is that, yes, it actually happens that persons have been vaccinated and they become ill. So there are 2 classes of these illnesses that I want to highlight. The first is COVID-19 itself. Yes, and there are a number of ways in which COVID-19 can occur after a person was vaccinated. None of these ways have to do with the vaccination themselves, because as Andy pointed out, the vaccines do not have the virus in them. 1, they could have had COVID-19 before they were vaccinated. They could have gotten the disease before they were vaccinated and not yet become ill. Because to get it is different from to become ill with it. 1, the vaccine could have protected them, but it takes time for the immunity to develop. So between the time that they were injected and the time period that their immunity takes to develop, because there is a lag period, they could have gotten the disease. The third one is that the vaccine may have failed in them. So those are 3 reasons why potentially a person just after having gotten the vaccine could have gotten COVID-19, but none of them have to do with the disease, with them getting the disease from the vaccine. The second class of illnesses that I want to talk about are what we call side effects, and there are side effects, as they are in every in every vaccine that we have ever gotten. The most common ones in the three major vaccines, the Pfizer vaccine, the Moderna vaccine, and the Oxford AstraZeneca vaccine, have to do with fatigue and weakness. That is, of course, excluding the pain that you feel in your arm, which many of us laugh at, but it's no laughing matter to those persons who have severe pain, not to mention those who would faint as a result of getting it. That too is a vaccine side effect. So the next second frequent one is headache. But those tend to go away within a day or two. The third, which is a life-threatening one, and is the major reason why after getting a vaccine, they ask you to wait between 15 minutes and half an hour after, is a severe systemic allergic reaction, which is life-threatening, though it is not a death sentence. So these are the things that can result as a result of taking the vaccine. To say a few words about the third one, all I can say is this, that certainly the Moderna vaccine, roughly about 1 in 100,000 persons were, when they first authorized it for emergency use in the United States, roughly about 1 in 100,000 persons got the severe anaphylactic reaction, which of course is more frequent than many other vaccines, which are 1 in a million. But you'd appreciate that 1 in 100,000 is a very, very rare event. So the question somebody asked about if you're safe to have the vaccine, if you have diabetes type 1, I need to say here, scientists should stick to their area of expertise. I am not a physician. For those of us who know the game of cricket, I am going to play within my crease here and not declare if any individual here who has type 1 diabetes should or should not take it. You should consult your GP. And there's a reason why I say this. Because scientists can behave very irresponsibly too. And you need also to ask yourself, when a scientist speaks, should he really be declaring on this? What I can tell you is this, that 10% of the persons in the trial in which the Moderna vaccine was trialed, in the clinical trial, had diabetes, and they got the vaccination, and it was deemed safe for them. I hope you see the distinction between the two answers.
Very good. Just to add just a few quick things there, Loxley. So I was looking at data last week on these you said allergic responses to the RNA vaccines. So there are organizations that collate the data. People have to report severe reactions. So in 18 million RNA vaccines given, there were 66 allergic reactions, and most of those happened within the first 10 minutes or so. So as you mentioned there, that's why people have to wait for 30 minutes. And I think it's right to say that with the AstraZeneca one, there actually hasn't been any allergic reactions reported. It is particularly these RNA ones, and it's not clear exactly why that is. It might be because they have polyethylene glycol in them, which is like a stabilizer, and some people are allergic to that. But that's, as I said, it was 66 acute allergic reactions in 18 million people that have been given the vaccine.
Right.
So
you can rest assured that the rigorous safety trials that these vaccines have gone through are among the rigorous out there for any drug or any substance that we inject in our body. They would not have reached this far were there serious considerations about their safety, which is not to say, again, that personal experience might not be that a particular individual who gets the vaccine may not suffer a serious side effect. We need to separate population effects, which form the basis for the approval or banning of any pharmaceutical, and personal experience. So let me move on to say, Andy, I don't know if you want to say anything while I find the next question.
Let's see. No, I think.
No, okay.
Well, just sorry. There is a question related to that, but it's.
So the question is: are all of these vaccines safe? Let me just limit myself to the Pfizer, BioNTech, and the Moderna, which are the first three in the queue. Yes, they're safe. Based on the clinical trials on which their effects were tested, yes, they are safe. Does the COVID-19 vaccine affect female or male infertility? Again, I have to say, based on the clinical trials that have been performed, there's been no evidence that they affect female or male infertility. There's a trial that is to be planned on male fertility, in which they have enrolled about 60 persons, and they're going to check the semen of that's produced, and that trial is about to start. But we have to, one issue. The answer to this question is that male or female infertility was not an endpoint of any of the vaccine trials. I think we would all appreciate that there were more important endpoints in question here, such as whether COVID-19 symptoms can be ameliorated or prevented by the presence of the vaccine.
Yeah. Can I just say there on the fertility, Loxley? So this was another example of an idea that kind of went viral because, and again, it's a thing of just getting a little bit of science and applying it in the wrong place. So, and this was one of the, I suppose, in the context of conspiracy theories and concerns that I'd heard from a number of people that people are adamant this will affect female fertility. And the reason was because there is a protein in the placenta that looks a tiny bit like the spike protein. Now, lots of proteins look like the spike protein because all proteins are very similar. And the idea was that if you have antibodies that attack the spike protein, they might attack this protein, syncytin-1, in the placenta as well. And therefore, it's going to affect fertility. There's absolutely no evidence for that. And in fact, as people have pointed out, anyone who has had SARS-CoV-2 will have developed antibodies to the virus. And there's no evidence at all that SARS-CoV-2 infection itself affects fertility.
So let's move on to there's a question about if the vaccine did 100% protection against COVID. Now the question, the short answer to that is no. There's no vaccine that is 100% protection against COVID. But it's important to understand protection against what are we talking about. These vaccines are designed to protect you against the progression, against the symptoms, clinical illnesses with COVID-19. The endpoint in the trials were not to determine whether they stop you from getting the virus or they stop you from transmitting the virus to others having once gotten it. When we say that the Pfizer BioNTech vaccine has a 95% vaccine efficacy, what we are saying is that it is protection against clinical illnesses of COVID-19. So we still have some way to go in determining how well these vaccines work. And there's a term that we use in epidemiology called effectiveness, which is different from efficacy. Effectiveness has to do with how it works in the real world. And how it works in the real world is a function of many things. How the direct effect of the vaccine on you, and the effect on the population that comes indirectly because a certain proportion of persons are vaccinated. That's something for Christians to think about. So we have both direct and indirect effects of the vaccine. And we don't know yet what the indirect effects of these vaccines are. But there certainly is some suggestion that though it has not been tested, though it was not the endpoint, they do give some protection against getting the virus, and they do give some protection against transmitting the virus to others once you have gotten it. The truth, though, is that we don't know for sure, and those studies are ongoing. One thing that I want to point out to you, though, about indirect effect of the virus, that even if these vaccines were not to give any protection against being infected, we would have to reflect on what it would mean if we were to reduce the amount of sick persons around us. Parents having to stay home to take care of them because they're ill. Hospitals being overburdened being released from their burden on not having to treat extra sick persons. And we have to think about the fact that so many persons are occupying ICU wards with COVID-19 means that there are other illnesses which would otherwise be treated, which cannot be treated. We need relief from that.
I just come in quickly there, Loxley. So the RNA vaccines, the Pfizer and Moderna ones, I think it's just important to note that scientists and doctors are absolutely amazed at how effective they are. I mean, nobody would have predicted that they would be this effective, up in the 90%. And there's a few resources actually I might send around afterwards. But the New England Journal of Medicine have an ongoing vaccine Q&A, and they update it all the time. And one of the professors of medicine, Harvard Medical School, inputs into that, and Paul Sachs, he said about the results from the RNA vaccines. Overall, these impressive results, the 2 RNA vaccines up there were our most effective vaccines to date, more like measles than influenza, at least in the short term. The protection is far better than anyone anticipated. So, we don't know how long the protection will last, and we can discuss it a little bit later about the variants. But, the results were just so, positive from those trials that we were all rejoicing because, even if they had been 60% effective, that would have been a good result. But to be 90% is just incredible.
It's incredible. And let me just say 2 quick things about what we mean by, say, a 90% efficacy. What that actually means is this, that a person who gets the vaccine is 90% protected from the virus. Or another potential interpretation is that of 100 persons who are vaccinated, 90 of those 100 persons are completely protected against the virus, and 10 not at all. The truth is that we do not know. The truth is that we do not really know which of the 2 is true. But the high efficacy of 90 or 95% suggests to us that it may not be terribly important which of the 2 is true. Just to speak about the fact that some persons get the vaccine and get ill, I just want to point out to us that there's a difference when you begin vaccinated in a context where the virus is rampant like this. The chances of you already having it is certainly much higher than under normal circumstances in which we take our children to get a measles, mumps, and rubella vaccine. Because what we do with our children is that we keep them protected before the time of their vaccination is ready, and then we take them to get vaccinated. So the chances of them being exposed to the viruses are very small. In this particular situation, in the context of an epidemic, it is inevitable that some persons will be exposed before they actually get the vaccine.
Very good. You want to take the next one, Loxley, as well?
Yes.
Over 65?
The issue of the over 65. So one of the basis, the best vaccine for over 65, I cannot tell you. What I will say is this, that the Pfizer and the Moderna seem to have more persons enrolled in the trials in that age group. The AstraZeneca, one of the complaints, the Oxford AstraZeneca vaccine, one of the complaints about that is that they had fewer persons in the original trial in that age group. And so what they're saying is that we do not have as strong a basis to believe that is as effective in that age group or not. I should point out, though, that the WHO has approved its use for persons suggested that it can be used for persons over the age of 65. But the trials, the issue arises mainly because of the age group of the persons that were enrolled in the trials.
Yeah. Very good. Okay, so we're still looking at the issue of how effective the vaccines are. And there was a couple of really good questions about the issue of, are we going to have to take a vaccine every year? Will it be like the flu? Do we know how long protection will last? So I want to just put up another slide, and hopefully won't bring you all down a rabbit hole here. But I'll try to just give a little bit of background information on this before we... So let's see. Okay, can you all see that new slide? Yeah. So So this is the issue of the virus becoming endemic. So we're in a pandemic at the moment, and are we going to totally get rid of SARS-CoV-2, or will it be like flu that it's sort of kicking around all the time, and we may have to we may have to keep taking vaccines, and are the vaccines going to be effective? Well, this is just from actually about a week ago. This is one of the key questions that people are discussing right now. So it is a good question, and we don't have all the answers to that. So let me just read out some of the questions first. So will the vaccine have to be administered every year like the flu jab? Or in other words, do they know at this stage how long the vaccine's effective for? Is COVID going to be like flu, where you need a jab each year to prevent it? So and there's other questions like that. So it's unclear is the answer so far. People, when scientists were asked recently, this is just a poll here, what factors would keep SARS-CoV-2 in circulation if it did become endemic? So if we don't ever get rid of the virus, but it's sort of there like flu, what would keep it going? And so 71% said that it would be immune escape. This is the variance, so the concern that if the virus mutates, it then becomes resistant to the vaccines. We'll talk about that in a bit more detail in a sec. Waning immunity, if it's the case that we know the vaccines, as we said, are really good, really effective, but we don't really know how long that protection lasts. So far it's good news, because people have only been able to look at about 8 months, because that's only as long as people have basically 8